Good afternoon. This stage, good afternoon, everyone, and welcome to the Galway launch of the Patients Deserve Better campaign for investment in neurology nurses. I'm delighted to welcome our guests this morning. We have a great lineup. We have local consultant neurologist, Dr. Michael Hennessy, and two local individuals living with neurological conditions who are going to give a testament to the local services and challenges here in Galway and surrounding counties. We have Aoife Kelly, who's a local Galway woman living with epilepsy, and Robert Joyce. So before I start this morning, as I say, I want to welcome everyone to the event. A number of our patient organisations, and we have over 30 national patient organisations within the Neurological Alliance umbrella, supporting the over 800,000 Irish people living with neurological conditions. And many of those organisations are supporting our Patients Deserve Better campaign. And they're attending the webinar here this morning. I'd also welcome, we have a very strong showing from the registration of local elected representatives, and I'd like to welcome them here this morning and thank them for their time. I'd like to thank Roche for supporting our Patients Deserve Better campaign. We've already launched the campaign in Limerick in October. We moved to Cork in November and had a very strong showing there. And now we're focusing from today and for the whole month of December, we're focusing on University Hospital Galway and the nursing shortages there. I would encourage everyone to use the chat function this morning to introduce themselves and also to let us know who is here. Also to ask any questions. I'm going to let each of the speakers speak without interruption. So I will go first, then I will go to Dr. Hennessy, then Aoife, and then Robert, and do a final roundup then of the messages. And then I'll invite any questions from the chat to the relevant speaker. So maybe hold your questions, put them in the chat or the Q&A function, and we'll do our best to get to all your questions this morning. So I'm going to kick off just with a few slides on about the campaign. I won't take very long because I want to get to the people who really know what's going on in Galway, our speakers this morning. But as I say, I'll just do a short few slides, just giving a little bit of the background to the campaign. You just bear with me this morning. Okay, so the Patients Deserve Better campaign, it's a nationwide campaign. And as I say, it's aimed at addressing the shortfall in neurology nursing all around the country. And we've just started there with the focus today, which is on Galway University Hospital and its nurse staffing and neurology nurse staffing and shortages. But Dr. Hennessy is going to talk in much more detail about that. I just want to give really the headlines of the campaign. As I say, we launched this campaign in October with a focus on Limerick, then moved to Cork for November and now Galway today, and looking forward in 2022 to going to the remaining neurology centres around the country before we finish up in April with recapping on the national messages. And I suppose our aim really is to build support around the country for this campaign, really address the needs in regional centres, and then bring in a nationwide focus to reiterate our messages. And we will be calling again on the elected representatives who've been so proactive in supporting this campaign all throughout the country to show their support in April when we do that national recap and national focus. And to thank some of the patient organisations directly involved in the campaign. NAI itself is an umbrella of over 30 patient organisations, but the organisations on this slide are directly involved with the campaign because specialist nursing is key to the management of these neurological conditions. So I would like to thank all those organisations, many of whom are represented this morning, for their ongoing support for the campaign in all of the regions that we're going to. Just to give an overview really of the situation in relation to neurology services in Ireland, we've seen waiting lists increase very significantly over the past 5 years, even before then, but critically over the past 5 years. So the latest findings from August 2021 that nearly 24,000 people are on a waiting list for a neurology appointment. And what we've seen over the past 5 years is an increase in the number of people waiting longer amounts of time. So that 18 months, which is an incredibly long time waiting to see a neurologist, has increased, the number of people has increased from 355 in 2015 to over 8,000 now in 2021. And that's with, and I have to stress that, and Dr. Hennessy will stress that as well, that's with a huge increase in activity within neurology centres. So they're making every effort to get through these waiting lists, but we just have chronic critical understaffing. NAI did a survey of all neurology services in 2020. What we really saw was understaffing in all areas. But in particular in relation to neurology nursing, and really neurologies and nurses are key. They're key to the effective working of neurology services, but also key to tackling those waiting lists and reducing the demand on consultant neurologists to see absolutely each and every patient every single time. You'll get some information on our Patients Deserve Better.ie website. I encourage people to visit it, and it will give the evidence base for the campaign we're doing around the country is that nurses play such a critical role in so many aspects of the delivery of neurology services, from keeping people away from accidents and emergencies, from reducing admissions, as I say, reducing the people's need to see the consultant neurologist. And Robert and Aoife will talk today about the most important part of the nurse's role, which is direct patient support for people with neurological conditions. But just to stress, and as I say, if you visit our website, you'll see so much of the evidence base for this campaign on the importance of neurology nurses to the effective running of neurology services and hospitals as a whole. There is a national shortage of neurology nurses, and this is one of the things that came out of our 2020 survey of neurology centres nationwide. The shortage is particularly acute outside Dublin, again in the regional centres. Many neurology patients in Ireland continue to have no access to a nurse specialist, and just one recent finding, a national mapping exercise for Parkinson's services that's being carried out by Professor Suzanne Timmins, and the initial findings from that national mapping show that 80% of people with Parkinson's disease in Ireland, for example, don't have access to a nurse specialist. And we know anecdotally from our other patient organisations that there are issues with access to nurse specialists across neurological organisations. So, for example, there is no specialist nurse for people with Huntington's disease throughout Ireland, for example. I'm going to stop talking now because I want to give the floor to our other speakers, but I would just encourage people to visit our the campaign website, patientsdeservebetter.ie, to follow the campaign at the hashtag Patients Deserve Better, and in particular to visit that website because there is a facility to contact your local TDs to let them know about the campaign and to just urge their support in taking action to address the nursing shortfalls around the country. So I'm going to go now to our first speaker, Dr. Hennessy, just to talk in more detail and depth about the service in University Hospital Galway and the strengths and the challenges associated with the service. If I could move to you, Dr. Hennessy.
Sorry, I'm unmuted. Thank you very much, Mags, for asking me to speak to you today, and the NAI for launching this initiative, which is really of crucial importance to the running and the development of neurology services in the West. I'd just like to present a few slides to share our experience of the current state of neurology in Galway. So just to give an overview of what we're actually dealing with, brain disorders are extremely common, and at least 1 in 3 of us will experience some form of brain condition in our lifetime, perhaps 1 in 2. And the annual cost is estimated to be in the order of 800 billion euros in the EU in 2015. One way of measuring this is to describe a thing called disease-adjusted life years, and that refers to the number of years lost due to ill health or disability or early death from neurological disease. And that accounts for about 10% of global disease-adjusted life years. So it's a huge problem throughout the world. We have only 37 neurologists in Ireland. That's about a third of what they have in New Zealand. And the Danes have 6 times the numbers of neurologists that we have. So in terms of in comparison with international statistics, we're way down, probably at the bottom actually. And that's been the case for many years. So the population of Galway, Mayo and Roscommon, which we primarily serve, is about 500,000. But we also see patients from Sligo, Leitrim, Donegal, Westmeath, North Tipperary, Clare and Limerick. So huge catchment area. There are currently 4.5 whole-time equivalent consultant neurologists working in Galway. And in fact, there's only been 3 who've been working in the past year for a variety of reasons, some due to COVID, maternity leave and so forth, but just 3 of us. There's currently a crisis in delivering neurology healthcare. The current waiting list for neurology outpatient appointments as of yesterday is 4,500. So that's a huge number, and frankly becoming impossible. In terms of the individual diseases, well, multiple sclerosis is probably the commonest serious chronic neurological complaint we deal with. We have about 1,000 patients under active follow-up. The data from the Parkinson's Disease Association suggests that we have about 1,000 patients also with Parkinson's disease. My weekly epilepsy clinic has 40 patients. That's 2,000 patient visits per year with epilepsy. There are 23 individual specialists in general outpatient clinics in GUH each week. So huge volume of activity. Our inpatient neurology consultation work has increased significantly. We're consulted on average 10 patients per day in the general hospital. So there's a huge volume of activity currently underway with critical shortage of personnel to deliver this. There's also increasing complexity of neurological care. So for example, approximately 500 MS patients are currently on disease-modifying drug treatments. These are drugs which primarily influence the immune system. They require regular blood monitoring. This is all coordinated by our department, and currently is primarily delivered by the MS nurse specialist, with constant discussion and interaction with us. Over the years, and myself and my colleague, Dr. Coonan, have been in practice for about 20 years now. So we've accumulated huge numbers of patients with Parkinson's disease. And these patients have, over the years, become more and more complex as the disease progresses. So they have what are called motor fluctuations and other problems. And these really require frequent and exhaustive management. So patients would often attend every couple of months for adjustment and modification of their drug regime. Again, the role of the Parkinson's disease nurse specialist is critical. Migraine, incredibly common, 20% of the population, 10% of those patients have chronic migraine. There are now new treatments for the condition. These are called monoclonal antibodies, incredibly expensive treatments. So there's a need for extensive documentation and follow-up just to satisfy reimbursement of the treatments. Again, this all has to be delivered by the consultants. So increasing demands on our system, both in terms of numbers and the complexity of the treatments that are now becoming available. So can the specialist nurse fill the gaps? Well, the UK National Institute for Health and Clinical Excellence, NICE, recommends that for a population of 500,000 people, there should be at least 3 MS nurses, 3 Parkinson's disease nurses, and 9 epilepsy nurses. And that's not really including nurses who would be interested in other slightly rarer conditions like Huntington's or motor neuron disease. Currently, we have 2 what are called advanced nurse practitioners. And these have been in post for 7 years. They are able to prescribe and they're able to run their own clinics. So that's been a huge addition to our service and possibly unique in terms of the other neurology centres in the country. We have 1 MS nurse. We have 1 epilepsy nurse. A second has been appointed, but is currently working in ICU. We have no headache nurse. There is a Sláinte Care initiative which is looking at managing headache disorders by means of psychological support and nurse support. So there is some movement there, but we don't have a permanently appointed headache nurse. And actually, we don't actually have a Parkinson's disease nurse specialist at the moment. The previous holder is now an advanced nurse practitioner and has taken on other roles, and that position has never been backfilled. So really, we just have 2 MS neurology nurse specialists and 2 advanced nurse practitioners, so 4 in all. So in comparison to what we need, huge deficiencies. Again, like a lot of services, the individual neurology disciplines as led by nurse specialists are often dependent on one individual. So for example, we run a very successful multidisciplinary motor neuron disease clinic, which has really been valuable. It's been running for about 10 years. It's run by a nurse specialist, an advanced nurse practitioner, who really coordinates and runs a service that comprises the medic, occupational therapists, physiotherapists, social workers, representatives from the Motor Neuron Disease Association. It's a service that's really run by her and her alone. And you know, it's a sort of service that would actually break down if she weren't there. So not only do we need nurse specialists for the various subdivisions of our specialty, we actually need 2 people to ensure you know, a consistency of service delivery. There's ample evidence that nurse specialists are reduce costs. Most of these studies come from the UK. So in one trust, a Parkinson's disease nurse reduced patients' length of stay and reduced admissions, saving a delivery of £80,000. The UK MS Society reports that its funded MS nurses saved the NHS trust £60,000 a year per trust by treating patients with symptoms of MS at home. The NHS National Workforce Project showed that patients who consulted an epilepsy nurse specialist were less likely to seek additional consultations with a GP or a clinic doctor than those who did not, resulting in an annual saving of £184 per patient. So huge savings can be effected by implementing a proper nurse specialist system. What do we think they can do? Well, they can offer a more accessible source of advice between neurologist visits, reassurance, improved adherence to medication, lowering admissions. Nurse-led clinics are really at an infancy in our hospital. Nurse prescribing is available from the advanced nurse practitioners, very valuable. They provide a more at ease environment in which to talk about secondary symptoms or other quality of life issues. There's more involvement and recognition of the caregiver. It lessens the need for appointments with the neurologist, keeping waiting lists down. It brings the healthcare professional closer to the home and blurs the lines between health and social care. So overall, the NAI Specialist Nurse Initiative is greatly appreciated and welcomed, and must be viewed, I think, with a matter of some urgency. So that's all I'll speak for the moment, and happy to take some questions at the end. Thank you very much.
Dr. Hennessy, thank you so much for that and your very focused review of specialist nursing within Galway and how it fits into the service. You've given a fantastic insight into that this morning, and we really welcome the support for the campaign. And really, it's so clear the impact nurses have on the service in Galway, how they're critical support, and you're certainly echoing a lot of the research we did to inform this campaign on the cost savings associated with specialist nurses and their importance to patient care, and their importance to, I suppose, the overall efficacy and efficiency of neurology services. So thank you so much for that. It's a fantastic, I think, support for the campaign this morning, and are really, really showing us in a regional centre like Galway how nurses play that key role. And as you say, oftentimes they're a standalone service themselves for specific conditions, with the whole service really a lot reliant on one individual, which is not sustainable. And so I'd like to go to our next speaker now, Aoife Kelly, this morning. Aoife is a person living with epilepsy, and she's going to talk, I suppose, about her own personal experience living with epilepsy, and as well that key need for an ongoing source of advice, information, support that you mentioned, Dr. Hennessy, that's literally available at the end of a phone for a person who has access to a specialist nurse, but which isn't available to a lot of patients living with neurological conditions in Ireland. So I want to hand over to yourself, Aoife.
Thanks very much, Mags. So hi everyone, my name is Aoife. I'm 22 years old, and I've been living with epilepsy now for 10 years, since October actually. So I was first diagnosed in 2012, and I have two types of seizures. I have tonic-clonic seizures and absent seizures. So it was quite hard at the beginning, and especially as a 12-year-old, to comprehend what was going on, and the whole process of my diagnosis was very daunting as well. And it took some time to get a proper diagnosis. And thankfully, I have been seizure free for about 5.5 years now, which is absolutely fantastic. So very, very thankful. But yeah, just, my own experience with neurology nurses, like I suppose the hardest thing I found was the transition from the child care into adult section was very, I suppose when I went into the adult sector, I felt like I had not no support, but I felt very reliant on my neurologist and my GP. And there is certain things that impact a person with a condition they might be considered as little things, but they're big things. For example, like learning to drive, traveling abroad, starting a job. Like, how would I inform my employer on my condition? And if I ever had a seizure in the workplace, like what would I do? And these are just like very little things to me, or they might seem very little, but they're quite big for me. And I just wish I had that support, that I could just pick up the phone, and say these concerns and that were making me anxious, rather than have to wait months for my consultant, you know, for my neurologist to answer them. And like, you know, Dr. Hennessy said, it's very demanding, you know, to have to wait for your neurologist to answer all these questions, like when you can just pick up the phone and you could ask the neurology nurse. And I think one of the biggest anxieties that I had, and I suppose everyone had in the last year or so, was COVID and the lockdown. And I really suffered with like anxiety surrounding my condition, because I was like, well, if I get COVID, how is it going to affect my condition? Am I going to have seizures again? You know, am I going to end up in ICU? Like there was a whole anxiety around that. And then of course, how will the vaccine affect me? And these were just, you know, everyday thoughts that were going through my head over lockdown. And, you know, I became very isolated from my friends. Of course, we were in a lockdown, but, you know, as restrictions were easing, you know, I was just very mindful of protecting myself. And like that, I just kind of had to wait until I had an appointment, and that I could ask these questions, like that. You can pick up the phone and ask your GP or your pharmacist so much, but like neurology it's such a niche area. You really need the specialists to guide you and give you that reassurance. And, you know, it's just needed to have that support, like what Mags was saying, just to pick up the phone and you have these anxieties and worries surrounding your condition, that you know that, okay, well, I can ring them, I can talk to them, they're going to set my mind at ease. And if it is a case that it's, you know, more it's a more serious issue, that they can guide you in the direction of, you know, an appointment with your neurologist. But hopefully that these nurses and these specialists can answer your queries and questions over the phone for you. And I think like that with, you know, anyone can be affected with a neurological condition at any age. And I think even as an adult going through some kind of diagnosis, and like I said, I've been very fortunate that I've been seizure free for so long. But like, you know, there are people out there who have, you know, gone through having a normal day-to-day life, and then overnight, literally overnight, their whole life has just changed because they have been diagnosed with some form of neurological condition. And it can be very hard on them and their family and their friends as well, be it, you know, just a healthcare or a health issue, or from an injury, you know, that they have sustained the neurological condition. And to not have someone there, you know, that they can just contact rather than wait for their appointment with their neurologist, you know. So yeah, I think the nurses, it's such a big impact on someone's life when they have a condition. And I suppose like Robert will talk about his own, but like I'm sure he's the same. Like just to have that extra support means so much, and it may seem so small to someone else when they don't have it, but like it gives such a sense of reassurance and relief when you know that you can just ask these questions, and then you can save the more serious questions for your appointment then with your neurologist. So yeah, I definitely I think it's something that needs to be looked at.
Thank you so much, Aoife. I think when you talked about that experience during COVID, I mean, I think everyone has had such an anxious time, but I think that very much brings it all home to us, that you had the double anxiety of feeling extra vulnerable. And as you say, it's that piece of reassurance, that being able to lift the phone that you could have got with access to a specialist nurse. And I suppose repeat that by maybe every day, every week, every month, people looking for that reassurance. And I suppose, you know, just to bring back to Dr. Hennessy's point, these are complex conditions involving the brain. And it's where else are people going if they're not able to avail of the service of the nurse? They're attending their GP, which, as we all know, there are huge backlogs and difficulty accessing GPs. GPs are overwhelmed long before COVID, and now particularly as a result of COVID. So people are going to their GPs, they're going on neurology waiting lists that are ever climbing in order to get, as I say, that simple advice, reassurance, information, help and support in managing their complex neurological conditions. So you've given the personal experience, Aoife, of exactly why nurses are so critical to neurology services and to the care of people living with neurological conditions. So thank you so much for that insight this morning. Thank you very much. And I'll move now to Robert, who I think will echo a lot of what Aoife is saying in his own experience in relation to the value of neurology nurses.
Thank you very much for giving me this opportunity, Mags, and Dr. Hennessy and Aoife as well for your comments earlier. I don't think people really realize how complex an illness like multiple sclerosis is when it comes to its treatment. Obviously, you've got the consultant neurologist at the head, but we use services like physiotherapy, occupational therapy. We use urology services, seating clinics, podiatrists. Our needs are extremely complex because the wiring in our body is broken and the signals are not getting to the places where it needs to get. And we need to, in some way, slow down the progression of the illness to make it less impactful on our lives. And I've got multiple sclerosis now for nearly 30 years. And in the last 6 years, 7 years, it has steadily progressed to a more secondary form of the illness. And as a result, I've needed more support services such as wheelchairs, mobility scooters, physiotherapy, occupational therapy. I've needed access to a lot of complex systems within the health service. And I've had to navigate the public system in the hospitals, the community service areas, even going broader out into social welfare. It is extremely complex. Now, I have been a private patient for most of my life with MS, but 17 years ago, I had access to an MS nurse, and that stopped 17 years ago. And I've never had access to one since. So I've had to now coordinate my medical care. Multiple sclerosis affects me with fatigue, mobility problems. It has cognitive issues, and I've got pain associated with a comorbidity. I've got persistent headaches. To be able to navigate such a complex system as the HSE, you need to be fighting fit. You need to be mentally aware of all the possible paths that you can go down to treat your illness. And because I don't have access to an MS nurse, and I tried and I was refused because there are not enough nurses available in Galway, I've had to navigate this system myself and to understand what treatments I needed to go to, who I needed to see, and how to do it. And to give you examples of how this has affected me, I was very lucky to get a device called a functional electrical stimulation device, which helps me with my mobility. And mobility is crucial in maintaining my life and my quality of life, but allowing me to do things within this world. And because of not being able to access the services through an MS nurse, I was not able to get that device recalibrated so that I could continue walking. And I actually lost function as a result of this because of that delay. Now, if I had an MS nurse fighting for me within the service, I probably wouldn't have had that loss in mobility. That would mean that I probably wouldn't need the stair lift that I have now. And it probably would mean that I wouldn't need the mobility scooter that I need now. So the cost on the Irish Health Service, because of not having a nurse specialist to help me through the process and to get me the services I need when I need it, my disability is worse and the cost is greater. And this is the false saving that I think is happening with not employing enough of these nurse specialists to help us, guide us through the system. Now, I know other people with MS around the country, and their needs are complex. They are suffering because they cannot get through to a nurse specialist. They phone and phone and phone and phone and phone, and they don't get an answer. And as a result, then they go to the emergency department, or they go to their GP, or then they try and get an emergency appointment with their neurologist, which is blocking up time, increasing waiting lists. Whereas if you had an MS nurse there, they probably could have answered that question quite simply and triaged an awful lot of this so that it wouldn't overwhelm our health system. It increases the effectiveness of neurologists like Dr. Hennessy to have enough nurses. It improves the amount of people that he can get through in a week, I'm sure by a factor of 2 for every extra person that you'd have maybe. You know, I don't like having an illness like MS and the impact that it has on my cognition, the impact that it has on, say, for example, depression, mental health, mobility, ability to work, finding purpose in your day. And for me to have to navigate this complex system on my own without the help of a specialist is incredibly hard. And it leads to increased disability. I cannot think of a better way to improve our health service, neurological service, than by getting more nurses involved, because they will make our lives better. And I would be able to be more productive. I can do more things because I have less disability or less illness that I have to cope with. And I think that is for me, the biggest message of this is, as people, we are being pushed out because we're not getting the access to services. And it needs to change. It really, really has to change so that I don't feel like I've been abandoned by the health system and left to one side. It's actually soul destroying that you think that a service that is meant to be there to help improve us, have a greater quality of life, is not there, and they're making us like a second-class citizen. It's extremely emotional to think the stuff that I have lost because I haven't had the access. And I'm not unique in this. There are so many other people with neurological illnesses out there who are not getting services. And our lives are degrading far faster than they need to. Please, let's change this.
Thank you so much, Robert, for that. Both yourself and Aoife have been extremely moving this morning in your testaments of, as you say, and you said to me when we were talking before this call, Robert, of feeling pushed into disability because of your condition and just the lack of services to live well with your condition. And I suppose just to sum up the comments from our various speakers this morning, we hear so much about the problems across the health service. We hear so much at the moment about the winter that we're facing, the need to keep people out of hospitals, the demands on GPs, and the increasing the number of nurse specialists addresses so many of these problems. It keeps people out of A&Es, it reduces neurology waiting lists, it makes the lives of people like Robert and Aoife every day so much better. It keeps people well living in their communities. It provides the advice, support, reassurance for these complex neurological conditions. And as I say, we are not asking for anything as an add-on or an addition. We are asking for a basically resourced neurology service to be able to cope with demands. Dr. Hennessy has given a fantastic outline of the challenges within the Galway service, how critical the nurses are, how critically understaffed they are in terms of nurse specialist staffing in Galway, that people are promoted, but there isn't the backfill there in terms of clinical nurse specialists, and some positions are temporary, or they're not fully funded. And we would ask people to, as a simple way, directly take action for this campaign. We're asking our elected representatives on the call. The message is simple. You've seen the shortages of nurse specialists and what they do to improve not just the efficacy of neurology services, but the whole functioning of hospitals in general. I would ask people to visit Patients Deserve Better, where the website where you can directly contact your TDs and ask them to take action. It summarizes the information that we heard this morning about the value of nurse specialists, what they do, why they're critically needed. So the message from Galway is nurse specialists, those that are in post, are doing a fantastic job. They're keeping people well, they're keeping people healthy, they're critically supporting a very overstretched neurology service with significant demands on a huge catchment area, but there are not enough of them. It would make so much difference if the shortfall was addressed all around the country, but particularly in Galway this morning. As I say, we're calling on all of our elected representatives and to people to visit the website Patients Deserve Better, get in touch with their local TDs and give that strong message to them. I want to give a very sincere thanks to Dr. Hennessy, to Aoife and Robert, who have all done a fantastic job as ambassadors for the need for neurology nurses in Galway, for the Galway service and the surrounding counties this morning. And certainly, I think their testimonies have been very moving, but also very practical. In the difference that these health professionals would make if the staffing shortages were addressed. So I'd like to thank everyone this morning, and as I say, thank all our elected representatives for attending, and hope they've listened to our messages this morning. Thank you.